Hi everyone, I'm Megan with the Kentucky Humane Society, and we're here at CVCA with Nicholas. As you guys know, Nicholas came to us with a heart condition, and we're here with a specialist to talk all about it, so I'll let her introduce herself.
Hi, I'm Sarah Bell, and we're going to be talking today a little bit about what we've diagnosed with Nicholas and his heart. So I'll try and keep this so that the camera can see too. So Nicholas was born with a heart defect called a patent ductus arteriosus, or what we call a PDA for short. Essentially what that is it's a normal fetal structure that helps for blood to bypass the lungs in the fetus. Some percentage of dogs, a really small percentage of dogs, are actually born with that tube that doesn't actually close when they're born, and so they will end up with a tubular structure that is a communication between the aorta and the pulmonary artery. And so every time his heart beats, some of the blood, instead of just going straight out the aorta to the rest of the body, will bypass the body and go out to the lungs, back to the left side of the heart. This ultimately leads to the left side of the heart getting bigger with time, and in about 2/3 of dogs will lead to the development of congestive heart failure by the time they're 1 year of age. The good news about this disease is that it's a fixable condition, and so it's got a really good long-term outcome. What we need to do is just essentially close this, tie that off. Nicholas does not have any other congenital defects. Some dogs will also have other things though, like stenosis of their aortic valve or their pulmonic valve, but he just has the PDA.
Good.
There's two options to close this. One is surgery, where they would go into his chest, make a small incision in his chest wall, go in, tie up that blood vessel, and then he would have to recover. It's about 2 weeks of activity restriction until that his incision is healed. The majority of the dogs do really well with that. It's a low complication rate, about 10% or less. The complications with that we can see are sometimes the suture, the stitch that's put around there won't completely close the defect, and so they can end up with a little bit of residual blood flowing around there. They can also, there is a risk where potentially that could tear during surgery, resulting in hemorrhage, which is not a good thing.
No, not for poor Nicholas.
The other surgery, which also has a little bit of a lower complication rate, is where they would put a catheter up the aorta, so up through his back leg, down his aorta, and then through this defect, and they would put a little thing that looks like a cup and saucer. Can you see that? It's called an Amplatz canine ductal occluder. And it specifically was designed for dogs with this condition, and they would put that plug in the abnormal blood vessel, the PDA, and it would seal up. There's some risk of hemorrhage at the site. They can have abnormal heart rhythms and things like that as that catheter is traveling up sort of near their heart. But by and large, this has a lower complication rate and is really well tolerated in most dogs. In either scenario, if the procedure is successful, it's a really great long-term outcome. They will end up living normal lives and won't end up ever having an issue secondary to this. They could go on to develop some other heart disease later on down the road, but this condition will be completely fixed.
So without the procedure, what would you say his average lifespan would be if he were to remain the way he is now?
Like I mentioned before, about 2/3 of dogs will develop congestive heart failure by the time that they're a year of age. Those dogs, once they get diagnosed with heart failure, live maybe a year to a year and a half past that point. So we would be looking at kind of maybe 2-3 years if he did not have the procedure performed versus he could live well into his teens.
And our veterinarian at the Kentucky Main site has only actually ever seen this happen one time in a shelter dog.
Oh, yeah.
But I know you're a board certified veterinary cardiologist. So how often do you see things like this in your work?
This is definitely one of the most common congenital defects that we see. As far as total percentage of our caseload that has congenital defects, fairly low. I would say we usually see maybe for me in this office, I probably see 4 to 5 of these a year. With all the CVCA offices, we probably see, I would say, somewhere around 75 to 80 a year in puppies. And like I said, it's a really good long-term outcome. And most dogs do great with the surgery without any complications at all.
Well, that's great. That's great for Nicholas.
Yeah.
Thank you guys for joining us. We thought she would explain it much better than we could. It's something we don't see very often, but we're really happy that we have her on board and she's going to be able to perform this operation for our Nicholas and give him a really good lifetime of love and happiness after this.